And we are now live.
All right, great. This is Senate Appropriations, and we are reconvening to take up H-266. We took a break because we wanted to make sure that anyone who was planning on observing the committee starting at 3 o'clock we would not want to get ahead of the schedule. So we're pleased we have interpreters here today as requested. And the bill is being presented to us by the reporter from the Senate Committee on Health and Welfare, Senator Lyons, and we welcome you, Senator Lyons, with your report. We also have Jen Carby from Legislative Council, who probably was one of the drafters or of the bill. So welcome.
All right, thank you. Senator Jenny Lyons for the record, and this is H-266. We've been working a long time on getting hearing aid coverage, insurance coverage. So just briefly, Vermont Medicaid covers hearing aids currently. Most commercial insurance plans do not cover hearing aids. Medicare does not cover hearing aids. And most funded employer plans, so the self-insured, do not cover hearing aids. So this bill really looks to put in place the continued hearing aid coverage that is in Medicaid. And then the bill also supports the current planning that's going on for our small group and individual commercial health insurance coverage. So this through the qualified plans, and so asks for the Department of Vermont Health Access and DFR to, Department of Vermont Health Access to make an application to the federal government so that we can expand our maintain expanded coverage for our qualified health plans. And then finally, the bill also provides for the large group commercial health insurance plans to cover hearing aids. And the coverage would be one hearing aid per year every 3 years, and that's consistent with what Medicaid currently does. So the bill, there are no public costs in the bill because Medicaid currently covers, and it adds coverage through our, or at least the ask to get the qualified health plan expanded to have hearing aid coverage, one hearing aid per year every 3 years.
And the it would have to be obviously Medicaid. It's an enrolled provider that it is covered in billing. Could you just delineate, we obviously have the commercial insurance, and then we have self-insured that are under ERISA.
Right.
So we can't touch the ERISA covered individuals. I just wanted to make sure people were clear that because of those federal requirements, those self-insured ERISA covered under ERISA rules cannot be required to provide this service. Although some of them might, their choice, but the mandate can't, or the requirement can't extend.
Right.
Senator Starr.
Yes. So if a person is on a federal program receiving Social Security, they would be covered.
If they get Medicaid, if they just
Medicaid,
but not Medicaid.
But if they have a secondary insurance, I think that's the question.
Oh, you mean like
You have a, like I have MVP, I have Medicare.
like a
and
supplemental
MVP.
plan?
You could buy a supplemental, but it's not mandated in here.
The supplemental, so
No.
for people, that's, why is that?
Perhaps we can, do you want to defer to Jen
Yeah.
Harvey to respond?
Sure.
To why is that, so to speak, on the a Medicare supplemental plan?
Right, so Jen Carby, Office of Legislative Council. So there's Medicare supplemental, which really helps with out-of-pocket costs on Medicare, but doesn't provide additional benefits. And then there's Medicare Advantage, which takes the place of traditional Medicare Part A, B, and in most cases D, that's Medicare Part C. So if you are getting your Medicare through a private health insurance plan, it may cover hearing aids, because some plan designs do, but we can't require it. They're all federally regulated.
The bulk of the people that contacted me
Medicare.
are people on Medicare
Yeah, it
with
doesn't
supplemental
cover.
plans. And they're gonna be very upset when they hear that this isn't gonna help them.
And there's nothing that the state can do about Medicare or the benefits offered
Because of
under
the federal
Medicare supplemental
jurisdiction.
or Medicare.
No, I understood, but I didn't realize that. Okay, so by and large, that older group who isn't eligible for Medicaid will again not be
Not Medicaid,
I wasn't-
Medicare.
Medicare.
Yeah.
Thank you. So once again, the people who are really asking me to support this bill probably aren't gonna be covered. They're gonna be disappointed.
So we need to be clear who would be covered that's currently not. And those would be people who are on Medicare, whose incomes are above the Medicaid eligibility. So they're not enrolled in, because Medicaid does cover. So the Medigap policies aren't subject to this. ERISA self-insured plans are not subject. We are making, we have a request to CMS so that those, the health benefits and the benchmark plans would include it, as well as the commercial plans that are not, that are outside the ERISA.
Right, the large group commercial insurance plans, there would be a requirement under this bill. So the state can regulate those and we don't need the feds to say, okay on that.
So this got, I know there was disappointment because the president had proposed in one of his larger pieces of legislation, coverage of hearing aids, and I believe dental, maybe
That was
as
one of the things that was
as
talked
part
about.
of a Medicare overhaul. And that's what would have really helped
And
this
it's
population.
very disappointing. I mean, that, some folks say, healthcare coverage covers everything below the neck. So not the eyes, the ears, the teeth. And it's, and Medicare certainly doesn't cover this.
So can you insure from the neck up with somebody?
We're gonna, yeah, we could try that.
So, community,
So-
this is coming to us because
I don't know why it can't.
because obviously it doesn't result in any expenditure, additional expenditure by the state, because we're already covering the benefit in the state budgeted Medicaid program. I don't think, we are self-insured state of Vermont.
Yeah, but we're exempt from, I mean, we can regulate, the state can regulate governmental self-funded plans, but state employees are not included in this.
State employees and teachers are not covered here. Even though, but they currently, they are putting in coverage for one hearing aid for each year, every 5 years within the VSA contract. That is happening. The question, and certainly during the negotiations process, both the NEA and the VSA could negotiate for what the Medicaid coverage currently is.
But people with hearing difficulties just seems to me totally unfair that it's not covered. And this isn't gonna help the group that probably the largest group of hearing impaired individuals are those that are over 65 or 66 or 67, whatever age now is Medicare. Medicare is still 65.
56 and
Over
65.
65. So, it's tremendously disappointing, but I don't think we should penalize those that will benefit by not supporting the bill.
There's
So
nothing we can do about that.
So
I understand, but I'm just saying,
Yeah.
if you'd let me finish, it is tremendously disappointing to hear that most of the people that contacted me aren't gonna be covered, but by the same token, I'll still vote for the bill because it's gonna help a number of people.
I just want to confirm the work of the committee and so forth. You have provided the coverage mandate to the broadest extent you can under Vermont authority.
As much as possible.
Okay.
So we, as I said, the SEA is getting coverage now for every 5 years, and NEA is not included in this, and they certainly can negotiate that under their contract.
But for the other,
Yeah, we did the best we could, and I will just tell you that
There's no direct.
it is really disappointing not to have Medicare coverage of hearing aids. It is a significant issue in our.
The failure of our, they talk a great game down there in Washington.
They're all too young to need hearing aids.
well, I'm not so sure about that.
Have you seen some of them?
My other comment though is it seems like on the news, there was
But they're
an announcement that they were coming out with an over-the-counter hearing aid and with a much more reduced cost because some of the costs are just astronomical that we're
The
hearing.
markup is 40, it's just huge, and so I think Senator Sorokin and I put a bill in a few years ago to try to get, to determine the cost and then what markup would be appropriate, but you can't figure it out, it's difficult. So you see all these ads for $1,000 an ear or $4,000, and now they're coming out with digital, and some of the European countries have cheaper digital hearing aids. And it would be great if we could have a market that was equitable and low cost.
The bill has no appropriation.
No, we need to move it.
I'll move the bill favorably.
Okay,
I'll second.
we have a motion to move the bill favorably, seconded by Senator Starr. And we're not sure why it was referred here, but we need to move it anyway. So unless it's further discussion, I'll have the clerk call the roll.
Senator Fallon, Senator Bowles, yes. Senator Nika,
Yes.
Senator Sears,
Yes,
Senator Starr,
Yes,
Senator Westman,
Yes.
Senator Kitchen.
Yes.
Okay, 601.
good solid. vote.
Thank you. And let's see. Well,
Which you've written all over.
yeah, I think so. I would take it from Medicaid, but
I just heard you
It's
say,
not.
what you say?
unless it's DFR. No, actually, I don't know, the benchmark plan, that gets into
Vermont
access.
Health Access,
It is,
I can do it.
it's DFR, I do.
It's a little bit of both.
DFR did the study, the initial.
Well, Bobby, did you listen to
Richie
this?
likes to stand up and be seen.
No,
so
I'm happy to pass this off to you, Bobby, but did you listen?
Look, I'll put an end to this since it requires.
No, I'll
Steve,
do it.
Okay, all right. Senator Westman will be more than happy. Well, if you want to do it and be pleased.
I'll be happy, I'll be happy. Now Bobby avoided his job.
Well, I'm more than willing, if it's instructional to Diva, to make the application to CMS, and that's, and so, thank you. Now, Senator Lyons, we have another bill, page 655. And that has to do with licensure,
Registration and licensure for telehealth.
We are finished with, we finalized our action on H266, and we'll move on to our next bill. A lot of people, but this is gonna come, yeah.
no, I have no question about many of the people I heard.
I thought it was gonna cover.
Well, we covered everything with the,
Yeah.
I mean, it's really frustrating.
Is there
to get out.
We have a little chart of
what does get covered and what doesn't, or.
Yeah, I do it, and I give it on, it's a list.
Yeah, I'd
And I
like,
give it to
I'd
you.
love to have it in terms of some people ask, it'd be really nice to be able
Okay.
to.
Was it
Covered by Medicaid or by this bill?
It's what I said in the beginning, and
Oh,
I'm
you said at the
happy to
beginning,
hear that.
right,
Yeah.
Medicaid, you're.
In Medicaid, you're covered, yeah, Medicare, you're not.
You're, sorry.
Well, you know, there's a lot of confusion about Medicare and what it covers, long-term care. People think nursing home care
No,
or a lot of the home care as an alternative, or residential care is not covered. And
and long-term insurance then becomes something that is so prohibitive.
That's turning out to be a thing.
so I'm going to move on now to H655, and we'll, fortunately, it's the same two witnesses
There
with
you
us,
go.
Senator Lyons and Jen Carvey.
So thank you. Continuing on at H655. This bill is an extension of the work that we've been doing on telehealth, and it involves licensure and registration for out-of-state healthcare professionals. So someone who is licensed out of state in another state, who would, for example, one of the things we learned during the pandemic is that there are students who might want to continue a relationship with a counselor, a psychiatric counselor.
Sorry, all right, Minnie, we need to go, I just wanted to confer with, because there is an appropriation, and I
Yes,
just
there
wanted
is.
to
There's a,
confirm with joint fiscal that this is an expenditure,
yes, it is.
potential appropriation.
It's
that
an
we
upfront
have.
expenditure.
All right.
But I'll just give a little background so you understand the necessity of this. So it allows for an out-of-state licensed professional to work in Vermont and work with patients in Vermont. And there are two levels of that work. So on one hand, it could be someone who wants to register in the state of Vermont and then work through telehealth with patients. And as I said, we heard from college students who were looking for some psychiatric support from their out-of-state physician or counselor. And so this allows for the out-of-state licensed person to, in section 3054, to register in-state and then treat up to 20 patients during a 2-year license term. So first we have a license, so the out-of-state doc, let's call it a doctor, it could be another professional, can be licensed for a 2-year period to treat 20 unique patients in the state of Vermont. And there's a cost to that licensure for that 2-year period. It's 75% of the regular renewal fee. So that's some money there that they would have to pay in to work in the state when they are licensed out of state. Then there's a second piece, which is a registration piece.
You have a
I
question?
thought we had a reciprocal agreement with other states.
This is not a compact. This is allowing for someone who is licensed out of state to work in state. We don't have anything like this right now, and it's only for telehealth.
We did it for nursing. Did we do it?
That's a nursing compact.
Right. So maybe that's what.
Yeah, that's what you're thinking about. So this is only for telemedicine, telehealth. So it's when you might have a doc sitting in California and you've got the students sitting at UVM or at Johnson, and the doc is now licensed to function in Vermont for this 2-year period and can treat his or her patients, up to 20 patients for this 2-year period. So it's you pay to be licensed in the state of Vermont, but very restricted in what you can do. You can only have so many patients. So that's the license piece.
So, could I ask a question? There are ads on TV where you can call, and they're like a doctor, And, you know, the ad of the kid with the sore throat.
Whereas May too.
Would that those services come under this? I mean, are they regulated or?
So they are, now they should be licensed, well, now, right now, in Western we have to, because we have pandemic and there's been a lot of just deeming them as licensed here, but in general, yes, they have to be licensed in the state where the patient is located. And so they would, until we create a telehealth, special telehealth license or registration, they have to get a full license.
But we have a lot of new people moving, or supposedly. If I move here from Massachusetts or Connecticut, I can't call my doctor back in Connecticut that's doctored me for forever and tell them what's wrong with me and say, oh, what do you think, doc?
They are,
Unless they get registered and licensed.
in general, they are required to be, and have been for a long time, providers are required to be licensed where the patient is. There is enforcement discretion that I think has been used both with our own Office of Professional Regulation and Board of Medical Practice and regulators in other states.
I think I've even done that.
Well, I don't know. It sounds like it might have been done informally, but.
Yeah, and so I can tell you stories about that too, because I'm married to someone who has, vacationed in New York State and has a family, relative, or a friend, and should be licensed in that other state. So it's not, but there, as Jen has said, the regulatory oversight is significant. This is very specific for telehealth.
And there's more of it now. I think the COVID really
Absolutely.
accelerated the fact that telemedicine and the care is solid. In fact, in mental health, I think that the research indicated that the treatment, even though it was done remotely, was just as efficacious as in person. So this is really trying to bring our rules, I would think, up to date with how quickly the delivery of care has changed as a result of COVID.
So just to continue on, there's a licensure piece that allows for, more patients and within the state. And then there's a registration piece that allows for a shorter period of time, 100, and restricts the number of patients further. So 10 patients over a 120-day period. So those are the two places where the Office of Professional Regulation and the Board of Medical Practice will be looking to develop rules and guidelines and applications, registrations, licensure. This is where all the costs lie in developing the program. And so the appropriations request to develop the program to have licensure, so the out-of-state licensure, and then the out-of-state registration, the total ask from OPR to develop the telehealth system is $360,000. So they also have indicated that this would be repaid. So it's like going forward, you need the money to get it started, and then once the money starts coming in, they can return the funds. That's what I've understood.
So, can I ask a question? So I'm wondering, so I understand how this happens and that's all well and good. But in terms of the billing, if your insurance company is not registered in that state, will they be billing to Vermont? How will they be billing?
Good question. It'll be, I would think that because it's the person is, let's say the person is a resident of California,
Right.
then they would continue to be treated by the same physician, so the billing would go through that physician's office. That's the way it would work.
Even though they're telehealthing with
Even though
with
they're
somebody
telehealthing
else.
in Puerto Rico.
Okay.
Yeah.
Other questions?
Well, I have questions about how you do dentistry with telehealth. I suppose you're just examining the
So,
teeth.
and this is exactly why the rules and the system needs to be written up
I'd like to have my dental work done.
You want your
remotely,
dental-
too.
so we're only gonna do fillings and cleanings by telephone.
So the way I've heard it explained in the past, as an example, is you could have a hygienist who was on site with the patient, but the dentist is remote and is
I'm
advising.
sorry, that's what it is.
I've done two things with telehealth. One, my wife was a neurologist in Massachusetts, which worked fine, and that was fine. But the dermatologist during the pandemic was like impossible. How do you see this on my hand,
I know.
So
Take-
it does have its limitations, but I'm
Certainly,
happy to support this.
So, committee, other questions or comments? I'm a little confused about repayment of these sort of.
I don't know how,
It seems like the
there's no repayment, Jen,
No, it's
now,
not
maybe we could just return to the.
But I think what we do know that I think your licensing fees were going to be
They'll be
less than
catching
full.
up.
Licensing fees will be less. They need them, basically, they need the money to start, I think they're already in the hole at OPR from COVID related.
We know that, when that, we dealt with it in the
So,
budget.
so this is the money that upfront money that they need to set up the program, but I think the expectation is that it will be self-sustaining.
After the fees,
After the-
and they probably are gonna have to look at their fee schedules
Yes.
relative.
Yes, they will,
Right,
as
and
it
this
starts
is
to come
very
in,
much
see how
sort
many.
of an estimate, but they don't know if this is the right fee amount.
So, this has a fee in here too?
It's right at the end,
And it has been to finance.
it's in section 3, right before effective dates.
That's the appropriation.
That's the
That's the
appropriation.
The
appropriation.
fees are in, section 7.
Right up, it's 3504, 3054. And so the licensure fee is 75% of the statutory renewal fee for the profession, so.
That's for the license, and then for the registration, it is the lesser of 50% of the renewal fee for the profession or the application fee for the profession. They're different, whichever one is less.
So then LPR is gonna have to look and see what the overall cost of,
Exactly.
regulating the profession and
Because they are
fees.
expecting to lose some full licensees who would change to telehealth.
All right, so the fees have been looked at, next door. And what we have, it's an appropriation to get the upfront work for the system.
Where is that?
Established, it's on the last page 15, section 3, 360,000.
Where is that coming from?
It's coming from us, that's why the bill's here.
We have
We have accounted for it. That's why I was checking with Stephanie, because we had a list of bills that were still pending, that had come over from the House, that we hadn't acted on yet. So
That's why we have
the money-
money aside.
the money has been set aside in anticipation of a number of bills. So the 360 has been reflected in how we developed the budget. So a further discussion? So we do have the money.
I'll move the bill.
All right, so we have a motion to move the bill favorably,
Second.
seconded by Senator Ruth. Further discussion or questions? I will let you call the,
Senator Ballard. Senator Burris, yes. Senator Nick.
Yes.
Senator Sears.
Yes.
Senator Starr.
yes.
Senator Weston.
Yes.
Senator Kitchen.
yes. That's OPR. You do, Bobby? Okay.
About that time we did something.
Okay.
I got a whole stack coming.
Well, thank you.
Thank you,
We'll,
Who gets that list that would be helpful?
I will send it to you.
I don't get tired.
only 3:30. Do we?
We done
I don't know.
Maybe fine tune where I can just,
Do we have 517? You said we do, and if Senator Chipton could come in, this is the one, we had some conversation earlier, and I was thinking we could deal, thank you very much.
Thank you, appreciate your time, effort, and
And
support.
and it was the fact that we have more money set aside for tuition assistance for National Guard.
Yep.
And it was to open it up so that if you had a degree in English, but you wanted to go back and be a nurse, you could qualify. And then I thought we could deal with it in the budget, but what came over from, in our Senate ad included purple designations and the adjutant general and some other things. But the main focus for us would be to allow those tuition dollars to be used. And they had many people who would be interested in coming into the Guards.
This is, if somebody has a degree that's not a critical occupation, and they want one.
That it would, the fact that they had that degree in archaeology or whatever wouldn't make them ineligible. So if we could take that out, because Senator Chitlin said he had some scheduling issues, and originally we thought we'd have to wait until Tuesday, but the more we can get these bills out, and if they're,
The better chance.
the better that they can get conference. So I don't know if somebody could
You want me to go get it?
see if he's available, but perhaps we could, can we go off live? And
What's the
we-
number of the bill?
517.
We'll go off live and come back on at,
Oh, and the other one is 515. I believe that's the one that Senator Cummings asked me if we could get out, and it's really a housekeeping bill for DFR, and she wasn't sure, I think, why we got it as well. But my goal here is to move as many of these bills as we can.
would you like to take a 10-minute break
Why don't
and
we
try to
do that?
organize?
Yeah.